My 3-year-old nephew asked me this question the other day. Uncle, what happens if you take a constipation and diarrhea medicine at the exact same time? Today we're going to find the answer to this question, which might seem a bit silly at first, but is actually quite fascinating from a medical standpoint. Constipation is a condition where stool becomes hard and difficult to pass, while diarrhea, on the other hand, is when stool becomes watery and the frequency of bowel movements abnormally increases. Since both of these symptoms cause significant discomfort, we often turn to medication for relief when they become severe. So what exactly happens if you take laxatives and anti-diarrheal medications together? There's a common misconception people have. It's the simple assumption that laxatives will just cause diarrhea and anti-diarrheals will just cause constipation. However, that is only half true. The actual outcome varies wildly depending on how the drugs work in our body. In other words, their mechanism of action. Therefore, we first need to understand exactly how these medications work. According to international medical diagnostic criteria, constipation is defined as experiencing 2 or more specific symptoms over the past 3 months, with the onset of those symptoms occurring at least 6 months prior. The medications used to resolve this condition are broadly divided by 2 main mechanisms of action. The first method aids natural elimination by altering the physical state of the stool itself, and the second directly stimulates bowel movements. The medications that alter the stool's state are further broken down into 2 categories. First are bulk-forming laxatives. The fiber in these medications mixes with the stool inside the intestines and absorbs water, directly increasing the overall volume of the stool. As the stool expands, it naturally stretches the intestinal walls, which in turn triggers our body's normal peristaltic movements. Because they facilitate bowel movements in a way that mimics the body's natural processes, rather than artificially stimulating the intestinal nerves or muscles, they are classified as relatively safe for long-term use. Next are osmotic laxatives. These medications possess a higher concentration than our bodily fluids, allowing them to draw water from our tissues and blood vessels into the intestines through osmosis. The gathered water softens the stool and increases its mass, smoothing the way for easier bowel movements. Similar to bulk-forming laxatives, these do not directly stimulate bowel movements, but instead change the physical state of the stool, making them highly safe to use. On the other hand, stimulant laxatives have a completely different objective than the previous 2. As medications that directly increase peristalsis in the gastrointestinal tract, they apply strong stimulation to the intestinal nervous system and muscle walls. The primary goal here is to forcefully shorten the transit time of stool through the colon and increase the overall frequency of bowel movements. Now, let's turn our attention to diarrhea. Medically speaking, diarrhea is defined as the passage of loose or watery stools occurring 3 or more times a day. Anti-diarrheal medications, much like laxatives, can also be broadly divided into 2 categories based on their mechanism of action. First, we have adsorbents. These medications act much like a sponge, absorbing excess water and toxic substances in the intestines to help firm up the consistency of loose stools. Because they normalize stool consistency without actually suppressing the intestinal movements themselves, they are considered a relatively safe option. The second category is anti-motility agents. These drugs act directly on the intestinal wall muscles and nervous system, actively slowing down the peristaltic movements themselves. By intentionally delaying the transit time of the stool, they buy the intestinal mucosa enough time to absorb excess water. This mechanism is highly effective for acute non-infectious diarrhea or functional diarrhea. However, they must absolutely never be used in cases of toxin-producing bacterial infections like food poisoning, or in emergency situations where a bowel obstruction is suspected. This is because the causative toxins would be trapped inside the intestines instead of being naturally expelled. Now, let's summarize what we've established so far. Laxatives consist of softeners that gently aid in elimination and stimulants that forcefully squeeze the intestines. Anti-diarrheals, meanwhile, include adsorbents that soak up moisture and anti-motility agents that bring intestinal movement to a halt. So, what exactly happens inside our bodies if we mix and match these medications? First, let's consider combining a softener with an adsorbent, or a stimulant with an anti-motility agent. In these scenarios, you essentially have two completely opposing forces colliding head-on. Therefore, depending on the patient's constitution and the dosage, the outcome will depend entirely on which medication ultimately overpowers the other. But what about combining an adsorbent with a stimulant? With the adsorbent soaking up all the moisture to make the stool hard, the stimulant will simultaneously squeeze the intestines tight to push it out. The likely result would be the passing of hard, small, fragmented stools, much like rabbit droppings. While this would certainly be accompanied by bloating and abdominal discomfort, it wouldn't lead to a fatal issue because the stool isn't continuously piling up to create a complete blockage. However, the true danger lies in the combination of a softener and an anti-motility agent. This is because the anti-motility agent brings intestinal movement to a dead stop, blocking elimination, while the softener continuously draws in water, endlessly expanding the volume of the stool. It's exactly like securely plugging a drain and leaving the faucet running. It closely mimics the severe reaction that occurs when a patient with intestinal paralysis consumes food. The fatal complication that can arise from this is known as toxic megacolon. Even in modern medicine, this is a terrifying medical emergency with a significantly high mortality rate. When toxic megacolon occurs, the large intestine swells massively, like a balloon on the verge of popping. A lethal systemic inflammatory response strikes all at once, featuring high fever, a rapid pulse, a spike in white blood cells, severe anemia, low blood pressure, and an altered state of consciousness. As the inflammation worsens and trapped gas and stool accumulate endlessly without escape, the pressure inside the intestines skyrockets. Eventually, the oxygen supply to the stretched intestinal walls is cut off, causing the tissue to undergo necrosis or rot away, and in the worst-case scenario, the intestine ruptures and perforates. Because this can instantly escalate into an extreme emergency requiring immediate medical intervention, you must absolutely never take laxatives and anti-diarrheals at the same time, no matter how curious you might be. Thanks to the simple curiosity of my 3-year-old nephew, we were able to realize today just how intricate the human body is and the precarious balance upon which this entire system operates. True scientific inquiry is not merely about experimenting out of idle curiosity just to see what happens. Rather, isn't it the process of learning to respect this magnificent balance of the human body, the very balance that keeps us safely alive and breathing every single day? Our bodies are not chemistry labs where we can recklessly mix and match whatever we please. The human body is in itself a perfect, expansive universe. So, did this adequately satisfy today's rather bizarre curiosity? If you wish to continue exploring the secrets of science and knowledge hidden within our everyday lives, please leave a like and subscribe to the channel. I'll be back next time with another fascinating topic to stimulate your mind. Knowledge delivered in just 5 minutes. This has been Flat Archive. Thank you for watching.